On the clinic, mostly animals like dogs and cats come, but if you go on a larger scale, the dairy farms, they all get their animals vaccinated from rabies. Everyone is coming willingly. The person who's bringing their cat or dog for vaccination, they know about the diseases, they know about about rabies, so they're all coming willingly. Because vaccination has increased in Pakistan, if we go back around about 10-12 years back, yes, there were cases of rabies. Their frequency was more if we go 10-12 years back, but now currently most of the people, they're vaccinating their animals, so it's a once in a blue moon that you see a rabid animal. The cases have decreased a lot. Vaccination, it's very important to keep your animals safe from rabies, but if you say that other ways except vaccination, then the only way is keep your animals strictly indoor. It doesn't have any interaction with animals from the outside. You can say stray dogs or stray cats, because rabies spreads through bite. And if your animal is strictly indoor, it doesn't have any interaction with other animals, that's the only way we can reduce it. We can't completely stop it by this way, we can reduce the chances of rabies. If we talk about symptoms, there are two stages of rabies. Well, the first one is called dumb stage and the second one is called excited stage. In dumb stage, the animal just confines itself to a corner, it gets scared of everything. Okay, it will avoid interaction with even its owner. That is the dumb stage. And if we talk about excited stage, the animal gets aggressive, it tries to bite everyone around him, even the owner. If you put it on a chain, it will bite the chain. And there's a misconception in our country, in this area, that a rabid animal, it's scared of water. No, it's not scared of water. In rabies, what happens? Pharyngeal paralysis happens and the animal can't swallow water. It tries to drink water but it can't swallow it, and it appears like that the animal is scared of water. No, it's not scared, it can't swallow water. Okay, if you say that it will spread like this, that the animal has eaten from a bowl and the other animal eats from that bowl, no, rabies doesn't spread like that. Rabies spreads through bite. When the animal bites the other animal, that's how it spreads. There are signs and symptoms. We can say that through signs and symptoms we can diagnose rabies, but there is no laboratory tests for that. Okay, the only way is when the animal dies or you put it down, you just chop its head off, bring out the brain. What does the rabies virus do? It produces negri bodies in the brain, and you can only diagnose rabies through those negri bodies, and you need the brain of the animal. Send it to the lab and then they diagnose it. Okay, cats and dogs, the initial vaccination age for rabies, it starts from 3 months. We give one shot, we give a booster dose after 21 days, and annually. When the cat is 1 year old or the dog is 1 year old, then we give a shot of rabies. When it's 2 years old, then we have to give an annual shot. First shot at 3 months of age, repeat it after 21 days, and then annually the vaccination is repeated. Yes, rabies is deadly, and because once an animal has acquired rabies or a human has acquired, there is no treatment for rabies, and we would say that on a scale from 1 to 10, it's a 10 surely.